So I wanted to let you know about a book that I've been reading recently, which is called Back Up, written by a journalist called Liam Mannix. I was really excited to read this book because actually it is one of the very few books that I have heard about as a chiropractor that really is written from the perspective of somebody who is trying to speak to our patients and trying to explain just how complicated and how challenging it can be to treat back pain. It's a really interesting book because the tagline says why back pain treatments aren't working and the new science of hope. So as somebody who's working in the medical profession, working as a chiropractor within healthcare, we know that back pain is one of those things that has been massively mismanaged over the past 20, 30, 40 years. You know, going back 20 or 30 years ago, my dad, for example, had a major spinal injury and he was seen at Headley Court, and the guidance that he received was to go on bed rest. Now, we know that actually bed rest can be enormously damaging for back pain. The structures in our back need to be kept moving in order for them to recover and in order for them to recover well. And the difficulty that we also have is that when somebody is told to go on bed rest, the message there is that movement is damaging for your back, which it isn't. The back really responds well to movements and appropriate exercise. So those kind of treatments were not only inappropriate in terms of your physical recovery, but also in terms of your mental recovery. So if you have been told, for example, not to move, not to exercise your back, and to go on bed rest because that's the only way for your spine to heal, the message that you're getting there is going to mean that any time that you are trying to exercise or move in the future, your brain at some point is going to remember that advice that you were given, which is be careful about moving, because you were told back then when you had this really horrendous back injury that movement was bad for you. So we're inadvertently teaching our brain that movement is damaging and is something that we need to be afraid of, and that is simply not true. One of the messages that I often tell my patients is to say that you can be sore but safe, and hurt doesn't equal harm. There are lots of these little messages, these little phrases that we can keep in mind that can help us with recovery from back pain. And I think it's really important to find basically any kind of media, whether that's YouTube videos like this, whether that's books, whether it's specific websites. It's really appropriate to check them through and to see what the guidance says in them, because sometimes it's simply not accurate. Now, this book is really, really well thought out. It touches on some of the really important things like disc degeneration and disc injuries. Now, again, disc injuries, it's one of those things, quite often people will come in to me and they'll say, I've been told that I've got a slipped disc, or I'm worried that I've got a slipped disc. Now, when we look at studies on cadavers, so when we're looking on studies on real human bodies, and some of the studies have actually been carried out on animals, for example, so we've looked at how discs behave in a range of different anatomical configurations, for want of a better word. Discs don't slip. You cannot budge those things for love nor money. There is no way that discs in our back are just slipping in and out. And again, it's one of those things that I think is really damaging in terms of the messages that we're receiving about back pain. So I was really, really, really pleased when I was reading this book to see that it touches straight away on the difficulties that people might experience when they have undergone spinal surgery, for example, and particularly because it's written by somebody who I believe is over in Australia, about the impact that the pharmaceutical or the medical device industry has had on people's recovery from back pain. It talks quite extensively about neurostimulators and being wined and these surgeons, for example, being wined and dined by people from neurostimulator companies and putting in these medical devices into people's spines that we know actually aren't effective. They don't work particularly well. They're enormously expensive, tens of thousands of dollars in some cases. And the lasting impact is that some people, after having these devices that have been sold to them as, in effect, something that was going to be a one-stop solution to fix their back pain, really, really wasn't. So again, talking about the book, but also talking about the impact that medical mismanagement on back pain has had, we've got people who've been told that they can undergo a surgery or have this device or this gadget fitted, and that it's magically going to fix their back pain, and it just doesn't happen. So here, for example, just to read a short snippet from the book, discs are designed to be hardy. They're the body's shock distributors, and they rarely complain. They can't by design, as they have barely any nerve endings. There are some nerves on the outside of the disc, but in a healthy spine, they don't go any further than 3 millimeters deep. The entire inner center of the disc, nearly all of its volume, is totally without feeling. And it goes on to talk about how the disc is designed to move and change as we put different pressure on it throughout the day. And it does, it moves and it changes, but it doesn't slip out of place. And this is what we have potentially been getting wrong so much, with the historical way that we've dealt with back pain of saying it's a slip disc and we're going to do this to put the disc back into place. It just doesn't happen. And equally, as we know, if discs don't have any nerve endings, they can't be pain generators in the spine. So it's often not the disc or any kind of disc injury that actually causes the pain, but it's more the reaction of the body to what's happened to the disc. Whether that's a small tear in the fibres on the outside part of a disc, or a slight protrusion of the disc where the disc protrudes slightly and then goes back to where it ought to be. It's that can be really difficult to wrap our heads around. But this concept of a disc slipping out of space in our spine and just going, I don't know where we anticipate it going, but it certainly doesn't slip out of place and then slip back into place. A small part of it can protrude, but that part tends to heal and tends to recover. And again, this is backed up by numerous studies. It's one of the reasons why when we look at MRI studies and whether MRIs are useful for managing back pain, we know that they're not, because we know that we can put healthy people through an MRI machine and we're going to find disc injuries, disc degeneration, annular tears, so little tears into the outside part of a disc. We're going to find those in almost 80 to 90% of people, not altogether, and certainly different age groups have certain predilections to having different types of injuries. But we know that MRIs tend to find things that aren't necessarily a problem, and that you'll find in people who don't have back pain. So we find these things like disc injuries, annular tears, and we find them in people who have back pain, but also in people who don't have back pain. So what we know is that it's not necessarily the injury that causes the problem, it's the way that the body reacts to that injury that causes the pain and causes the issues that we have. So this book, again, explains that really, really well. It goes on to talk about good posture and that being a back myth. I often say that the best posture is the next posture. So actually, there is no one posture that is better for our backs than any others. And it goes on to talk about pain and profit. So talking about the very real financial costs and financial burden of back pain, which is something I think is always in the back of people's minds. Certainly somebody who comes to see me with back pain who is self-employed, for example, the real anxiety and the almost panic that it can cause. We had somebody in here recently who came to see us who was self-employed, hadn't been able to work for 3 weeks, and they've got a mortgage payment to think about, and with the cost of living crisis and stuff. So that in itself then creates anxiety, creates fear, and puts an enormous amount of pressure on that person to potentially get back to work a little bit sooner than they ought to. But it also changes the way that their brain is going to process the signals that it gets from their back, because the brain relies heavily on context and environmental factors in order to determine if we should experience pain or not. And if you are faced with potentially not being able to pay your mortgage, that pain is going to be much more sinister. Your body is going to be much more focused on that pain than if you were somebody who perhaps didn't have a mortgage to pay, or child nursery payments to consider. All of these factors that play into our experience of back pain. I remember, and I'll have to try and dig out the article, but I remember reading an article once about looking at, I think it was hand and wrist pain in piano players, and actually they found that piano players reported higher levels of hand and wrist pain because they needed their hands to work. So your brain is going to be much more geared up to any kind of problems within your hands if you're somebody who uses your hands for a living. So me, for example, if I have physically injured myself and I can't work, that's going to be significantly more of a problem than if I'm somebody who doesn't need to work, doesn't need to go out to work. So anyway, back to this book, because I digress. Talking about spinal surgery, talking most importantly about, let me see if I can find the title chapter so that I can hold it up and show you. The mind-body-back connection. 100%. So anybody who is a chiropractor, an osteopath, a physiotherapist, a manual therapist, a massage therapist, anybody who is working with people in pain, who is working with the spine, will recognise that the mind-body-back connection is vital. I cannot tell you the amount of time somebody has sat in front of me and said, I know that there's a psychological component to this, or I'm worried that you're going to tell me that I'm just making this all up. Why is my pain so much better when I'm distracted or when I'm at work, and it's so much worse as soon as I sit down at the end of the day? This is the mind-body-back connection. And there are so many research studies, there's so much evidence out there to highlight the fact that the thoughts and feelings that we have around our back pain are significant predictors of how well we will recover from an injury. It's one of the reasons when I see patients in clinic, we use stratified screening tools to identify people who might be at risk of developing long-term back pain or developing chronic problems because of the thoughts and feelings that they have around their back pain. So we use what's called the Start Back tool. It identifies people who are at high risk of developing chronic problems so that I can deliver an appropriate treatment plan that includes things like cognitive behavioural therapy approaches to help with this mind-body-back connection. So that's something that is massively, massively important. We know that most pain isn't caused by a problem with the spine or the disc. If this is something that you're really, really interested in, I would absolutely urge you to check out the work of Lorimer Moseley. He's a fantastic Australian, I believe he's a neurosurgeon or a neuroscientist, sorry. And he has done so many useful studies. He's done some TED Talks that you can look at that all explain pain in a really, really accessible way to help you build your understanding. Because again, we know that the more that we understand our backs and the more that we understand what's going on within our bodies, the better we were able to control, cope and reduce our pain levels. So I was really, really pleased to see that this link between the mind and the body is really coming to the forefront of the way that we're talking about the spine. The one thing I was disappointed to read in this book is the comments that they make about chiropractic, which again, chiropractic in itself, the history of chiropractic is that it was developed over in the States by two people called D.D. and B.J. Palmer. And originally it was founded in theories that we now know aren't accurate. So we know that subluxations within the spine don't cause disease. Unfortunately, there are a very vocal faction within the profession, it's a small but very vocal faction of chiropractors who still subscribe to that theory and refer more to philosophical chiropractic and the philosophy of chiropractic, which was that adjusting these subluxations within the spine can heal pain and can heal diseases. So I was a bit disappointed that this book talks about chiropractic not being an evidence-based profession. Within the UK, it very much is. You do need to research the practitioner that you're going to see, but actually there is a massive body of evidence now that supports chiropractic as a manual therapy. It supports spinal manipulations as an evidence-based approach to managing back pain. And chiropractors incorporate manual therapy, exercise advice, soft tissue work, cognitive behavioural approaches to pain, self-management guidance at home, and even factors like diet, nutrition, sleep. All of these things form a package of care. And if you're interested, again, in reading some of the research articles that support the role that chiropractors play in managing back pain. There are things like the Bromfoot report or the Cochrane review. There's a lovely study that came out of Denmark, the Nordic maintenance program, which talks about the benefit that chiropractic care or chiropractic interventions can have in supporting people in reducing the number of days of problematic pain that they experience each year. And there's more coming out every day. There really, really is. So yes, there is a small group of people within the profession who unfortunately give the rest of us a bad name. But to say that chiropractic isn't an evidence-based profession isn't true. So that was the one disappointment within this book. I was really, really hopeful as I was going through, and I was going, yes, 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 this is all great. I can share this with my patients. And then unfortunately that, because, as I said, unfortunately the evidence-based chiropractors don't tend to be the ones who are recording lots of videos of people scantily dressed being adjusted on the bench, because we're not interested in clickbait. We're interested in getting on with helping our patients. So that was the one disappointment, but actually overall, I think this book could be really, really helpful if you are somebody who is experiencing back pain and wants to build your understanding of how your back pain should be managed, the conversations that you should be having with your healthcare providers, with your clinicians, with your friends and family as well. This book is really, really useful. As with everything, it's not a panacea, it's not the silver bullet, it's not the only book that we should be reading or that I would ask my patients to read. But it's certainly, if this is something that interests you, if you are somebody who feels like you've perhaps not cared for your back or not had the right treatment for your back, or perhaps you're somebody, like this happens a lot, you're somebody who's been to see a healthcare practitioner and you've wondered why you haven't been sent off for an MRI, why you haven't had an X-ray booked, why you haven't been told that you need to take various drugs and pharmaceutical interventions for your back. This will explain to you why we don't do that anymore. Chiropractors never did. Obviously, we're non-drug and non-invasive. But we now know, for example, that the majority of analgesic interventions that we have for back pain don't work particularly well. So that's why back pain, we tend not to see people being prescribed a lot of drugs for it, because it doesn't tend to work particularly well. But it will also help you understand why your first port of call with back pain should never be to try and push for an MRI or push for significant interventions into your back, because it's damaging. It's more damaging, in fact, than having those kind of treatments. It tends to result in increased fear being the back pain killer. And it tends to cause more problems and impact your recovery far more than if you saw someone like myself, as an example, where somebody who comes in with acute low back pain, it hasn't been there for very long, maybe they've had it for a week, it might be 10 out of 10 pain, but you've got a start back risk of chronicity, which is ranked as low. So we know that you're not having significant catastrophic thoughts about your back pain. We know that you believe it's safe to be active with your back pain. You're the type of person who would do well with a bit of reassurance and a bit of self-help guidance. And actually the research says that type of back pain will probably settle within 10 days to 2 weeks. If you are somebody who has a start back risk of chronicity rating as ranked as high, so you're at a higher risk of developing ongoing persistent or chronic pain, then we know that actually the research, the evidence and the science for managing back pain says manual therapy from someone like a chiropractor, an osteopath or an appropriately trained physiotherapist. Soft tissue techniques can be really beneficial. Acupuncture isn't. Ultrasound, no. Self-help techniques at home, so getting you exercising and mobilizing, these are the things that we know work most effectively for back pain. So it's really reassuring to find a book that explains in really accessible, easy to understand language, really well set out, to help us build a better understanding of why our backs hurt, what treatment works most effectively, and what you can do to help yourself at home.